Again, on balance, I think, even regrettably including the closure of schools, there is evidence to support the bulk of these measures. But there are, inevitably, I think, because they were produced in haste, some elements which frankly fly against evidence and reason and need to be reviewed and reviewed swiftly. The obvious example is the prohibition upon two people in the open air playing golf or tennis. There is no rational basis or evidence for this. It's a mistake to include them, and it's very clear that it's not necessary in Scotland. They haven't done that in Scotland. I don't think it's safe north of the border and unsafe south. That also creates a problem for many local authority and leisure centres who are struggling for income. That ought to be revisited. Similarly, the disproportionate effect of the ban upon alcohol off sales on micro pubs and small independent public houses, as opposed to the off-licence chains, ought to be revisited. That brings me to the point about parliamentary scrutiny. I'll live with those flaws in the regulations for the broader good if there is timely scrutiny and review. Leaving it 30th March without any review would be unquestionable. I welcome the fact the Prime Minister said earlier today that there would be the intention to bring matters back to the House as the vaccination programme proceeds. He also said that there was a legal obligation to remove redundant restrictions in the regulations as the vaccination programme proceeds. I hope the Minister will indicate what the mechanism is for that, because an obligation has to have a means of being enforced. In that instance, that means coming back to this House. If we can have that, then on balance, I could give these regulations my support, which has not been the case in previous instances. But we cannot use the gravity of the situation as a reason to overrule the normal requirements of proper parliamentary scrutiny. That is necessary in the interests of democracy and of the rule of law. I hope that the Minister will be able to give me those assurances as she winds up the debate.
Video link. Paul Blomfield.
Thank you, Mr. Deputy Speaker. And let me start by saying that I will support these measures today, simply regretting that the government is acting too late again. Clearly, these measures are necessary. So is the support for those whose lives are being affected by them. Ministers will know that too many have fallen through the gaps in the support schemes provided by the Chancellor, particularly in small businesses and among the self-employed, and especially in my constituency in the hospitality and creative sectors. I haven't got the time today to discuss all the ill-considered rules and deadlines, but I would ask ministers to agree to meet representatives of the excluded, along with those honourable members who have taken up their cause. So often in a crisis, it's those who have least who've been hardest hit by COVID. The government could begin to address this unfairness by making a commitment today that the temporary £20 a week increase to universal credit and working tax credit will be made permanent from April. Also to commit to extending it to the legacy benefits, ESA, income support, JSA. Mr. Deputy Speaker, this is a moment to pay tribute to the workers who have kept the country going and who will do so in the weeks and months ahead. Let's remember them as we move forward too, by tackling the low pay and fragile employment faced by too many of those in the private sector. And let's give those in the public sector the pay increase that they deserve, not the pay freeze that they don't. So much now depends on the vaccine. Let's remember that the first vaccine to enter British arms, which we should celebrate, was developed by Turkish origin scientists in Germany with an American company and manufactured in Belgium. An international response to an international crisis. I hope that will be reflected in our response more widely as a country. And I hope that ministers will confirm that as we roll out the vaccine in the UK, they will work with our partners around the world to ensure it also reaches those who desperately need it in low-income countries. Mr. Deputy Speaker, in agreeing to these measures today, Let's also resolve to tackle the injustices that have been highlighted by this crisis.
Thank you, Paul. Video link. Caroline Noakes.
Thank you, Mr. Deputy Speaker, and I welcome the opportunity to contribute this afternoon. We've heard a great deal of consensus across the House. We know there is a terrible toll on people, on our constituents, and every member who votes in favour of these regulations tonight does so with a heavy heart, balancing the impacts carefully and with recognition that they must be, for a minimum period of time, reviewed frequently, carefully monitored. We've heard from many speakers about the impact on children. My friend, the Honourable Member for Harlow, highlighted the terrible lockdown that the loss of social interaction is having on young people and their mental health. I was pleased to hear from my right honourable friend, the Prime Minister, earlier today that getting schools back is an absolute priority. It must be. And teachers, parents, school children themselves have reached out to me asking that I highlight their worries, as have the early years sector, who feel that they have not been taken with the government and have been neglected over the course of the last few days in announcements. I called back on the 12th of November for teachers to be prioritised for vaccination. Now, I recognise there are competing calls from all key workers, but I would like to make particular reference for those working in special schools where there is a very great need and where it is hardest for children to understand the importance of social distancing. Equally, there must be vaccination for care workers working in domiciliary care, employed by charities or working independently. And this afternoon, Age Concern Hampshire have highlighted to me their worries that these workers are going to go unvaccinated. The death toll for those with learning difficulties has been horrific. And the Honourable Member for Lewisham has highlighted the work my committee has done on this, publishing a report on the impact of COVID on those with disabilities. The commitment to rolling out information in a manner that can be easily understood, whether it's easy read, large print, Braille, British Sign Language, has been quite inadequate. As a result, people who need the most help have had an information gap, and that is not good enough. Gov.uk still does not have a BSL translation when there are apps that could do that quickly, easily, and relatively cheaply. But it is not just those with learning difficulties who have not been given enough information. Members of Parliament this afternoon have asked for additional details about the agreed schedule of vaccine delivery, about the approach to the equation between numbers vaccinated and a consequential lifting of restrictions. People have shown their willingness to comply with massive restrictions, but they want to understand the exit strategy. Early years providers want to know that they are as valued as primary schools. Golfers want a clear explanation why a walk with your partner with no clubs is fine, but with your clubs is not. People are not fools. The science is difficult and graphs can be bewildering, but ministers need to give us transparency and honesty. That is the key.
Your link. Karen Smith. Mute. Karen, you're on.
Thank you, Mr. Deputy Speaker. Retail, hospitality, care, building and trades are the biggest employers in Bristol South. There have been many job losses, but many people are working in those industries and they are keeping our city going. They have done everything the government has asked of them, and we now need to make sure they are safe and get this vaccine delivered and open our economy. Now, I've worked for many years with local GPs and the NHS in this city, and I know them well, and I've worked very closely with the team at Ashton Gate Stadium who are on standby to deliver this vaccine. We have a good standard of general practice in South Bristol, good collaboration. They've already started, and Ashton Gate have been ready for weeks, but they are all being kept in the dark somewhat about what the expectation upon them is and what is happening nationally with the rollout. So we have some basic questions that we'd like the Minister to answer, and they're basic project planning why questions. We know why we're doing this, but providers locally need to know what vaccine is coming. They need to know who, for example, is going to the GP. How far down the JCVI list do we want GPs to do? How do we want to call them? Now, I think it's sensible to do the over 75s, care homes, and maybe the clinically vulnerable. But GPs, if they are going beyond that list need to know, because basically they need to get back to their day job. We need to know where people are going to be vaccinated. Are the rest of us going to our GP, or are we going to Ashton Gate? We need to know when we're going. Now, I understand the reluctance of ministers to commit to dates, and this is a complex manufacturing, distribution and delivery process. But I agree with the member for Forest of Dean and Sheffield South East about transparency. And crucially, those delivering the service need to know. And absolutely, we as MPs on behalf of our constituency need to know when this is happening. Now, I've done a back of a fact packet estimation. South Bristol has got about 16,000 over 65. GP practices can do roughly 500 to 600 of these a day. So in roughly 30 days, if we know when this is being delivered, we could vaccinate all those over 65s on South Bristol, but it does depend on knowing when we're going to get the vaccine delivered and what the expectations are upon the deliverers. I will support these draconian measures tonight, but I do not want, again, the government to impose upon us here in Bristol the disaster of the national one-size-fits-all, crony-backed whack-a-mole nonsense that we've had from the government. Our local CCG is doing a good job. We've got good collaboration on the ground in South Bristol with GPs and with the people at Ashton Gate Stadium. They know what to do. They need support and they need clarity to get on with it and make our city safe to resume our normal working lives.
Sir Desmond Swain.
Mr. Deputy Speaker, this is a situation of state capture. The government is completely in thrall to a lobby, driving a policy that has manifestly failed. It's failed, or we wouldn't be here yet again. A complete failure. And yet we go through increasing iterations of this policy with ever tighter controls and restrictions in the hope that it might finally work. And then, when there is a possibility, as a consequence of the arrival of the vaccines, the crazed lobby has already begun to signal that the social control won't be over, that some restrictions will remain. Indeed, the chiefs have pointed out that they might have to be reimposed all over again next winter. So, for those colleagues who are contemplating voting for these measures this evening, buoyed up by opinion posters telling them that actually the voters are in favour of them, and indeed the voters crave for even tighter restraints on their liberty, I would point out that when the devastating economic consequences of this policy come home to roost, double-dip recession, years of slow growth because firms can't take up new opportunities because they're saddled with debt, those same voters who are so enthusiastic will abandon them, and they'll be back to point a finger of blame. And on that occasion, at least, they'll be right.
Definitely not on mute, Sir Desmond. Video link, Ian Paisley.
Thank you, Mr. Deputy Speaker. I have consistently voted against these restrictions because I will not be dragged behind the banner